Welcome, everyone. Thank you for joining us. I'm just going to introduce our topic, which is It Takes a Family, the impact of family participation in teen substance use treatment. I'm going to briefly introduce our presenters and they'll, share a little bit more about themselves. But we have Ellen Urtecho, our Associate Clinical Director at Evolve, and then Lindsay Behrens, who's our Substance Abuse Recovery Manager and Virtual Program Coordinator. So without further ado, I'm going to pass it over to them and they can get started.
Thank you, Kara. Yeah, thank you everyone for being here today. We will do a little more of an intro in a minute, but I just want to thank you so much for being here. And I know we have a lot of people from different levels of care. So in the chat, I actually, so Lindsay and I can get a better understanding of who our audience is. If you can just put the level of care that you're coming from and what family work looks like for you at that level of care. If you're meeting just with the client, and looping in parents if there's safety risks, if you're doing full-on parent calls and family sessions, just so that we can get, again, a little bit of some background. I know that we're going to have a lot of people from different levels of care, so thank you so much for joining. Okay, outpatient, some like school-based therapy, PHP, RTC. Thank you guys.
Yeah, quite a mix. Nice.
Yeah. All right. Yeah, so we can do some, thank you everyone. We can do some intros. Lindsay, you can go ahead and start us off.
Sure. Okay. Hi, everyone. I am Lindsay Behrens. I am a certified alcohol and drug counselor. I have kind of a dual position here at Evolve. So I am the virtual program coordinator for our PHP IOP program. And then I'm also the substance use recovery manager for the company. And I provide support for RTC, PHP, and IOP.
Thanks, Lindsay. Yeah, I'm Ellen. I am an associate program director. I've been with Evolve since 2021. I started as a counselor at a residential treatment center in Woodland Hills, associate therapist, primary therapist at our Agora Hills residential, and I'm now in an associate clinical director position. I also support with training for crisis prevention for the Southern California region of our company. So we're really excited to be here. We're really happy to have you all here, and we're going to just get right into it. So we're going to start off with just going over some basics. Throughout this training, we'll be talking about the identified patient using terminology that ranges on a spectrum. So the term identified patient can be interchangeable with client or participant. When we talk about family, this is including but not limited to parents, siblings, guardians, extended family living within the home. And when we talk about concerned significant others, this can also be another term that is interchangeable with family. Additionally, we acknowledge that when talking about individuals using substances, there's this spectrum of use that can range from an individual using substances habitually, there being problematic use, individuals with substance use disorders, and of course, clients who are addicted to substances. Okay, so we're just going to go over some of the learning objectives here. I'm just going to read down the list, that way you guys can get a full understanding of what you're going to learn in this training. So you will walk away with the ability to describe the importance of including family and substance use treatment for teens. You'll be able to identify at least 3 benefits to understanding the impact of substance use on family members and how that knowledge can benefit your clinical work. You'll identify how homeostasis can keep families from effectively engaging in the recovery process. And you will have the ability to identify how relapse prevention planning and contingency management can impact the recovery process in the home environment.
Okay, so kind of before we jump in, I do think it's important to acknowledge that, family involvement has not always been standard practice when treating individuals with substance use disorders. So for a long time, family involvement was either just not included in treatment, or it was seen as this additive service. And because it was seen as this additive service, even once it was being more included, it sometimes wasn't done in the most effective ways. And luckily, we've seen this shift, right, where family involvement is being seen more as a priority in treatment for substance use disorders. Now, although it is becoming more of a standard, especially when we're looking at the teen population, and isn't a universal practice. And there's such a wide range when we look at what family involvement can look like. I mean, even going back to the question that we asked you guys in the beginning, I'm seeing some people here, it says family calls, some says one session, some says wraparound care, some says in-home care. So there's all these different types, right? So it can look really different from case to case or depending on the level of care. So since there's this big spectrum, we really hope to highlight throughout this training the benefits of including families in more diverse ways. So to go over some more general basic information to set the foundation. Some key ways family participation is part of evidence-based treatment for substance use disorders. So we know that community and family support can really improve treatment engagement, retention, and outcomes for individuals with substance use disorders. Substance use disorders affect family members and concern significant others of those who use substances, not just the individual themselves. So, if we only look at the identified patient, then we're really only looking at one piece of the puzzle, right? And given how much substance use can affect the whole family, individuals in the family, the whole system, it's really helpful to look at as much of the picture as possible for the best outcomes. And then also acknowledging that family plays an important role in the change process. So, family can sometimes be a contributing factor when we look at why someone maybe started using substances. And it can also be a contributing factor when we're looking at helping an individual to not use after treatment and to sustain recovery. Now, we're not saying that family has control over outcomes of treatment. Of course, they do not. But there are choices that family members can take to influence the individual and influence the family dynamic. And when the environment is altered positively, that can influence overall change and motivation for the client. And that's something that we're definitely going to be talking about a lot throughout this presentation. Okay, so why include the family in treatment for substance use disorders in teens? So, families and are really adolescents for social community, right? What they learned, what was modeled for them, that's really played a role in how they kind of view and see the world. So, including them can really help gain insight into this. Also, our teens are typically living with their parents and their family throughout their recovery journeys. And let's say, you are working in an RTC level of care or a hospital, oftentimes those teens are still going to be returning to that family post discharge. So they're really just directly going to be a big part of that identified patient's environment. And we know through a lot of research that environment plays a huge part of continued sobriety. There also is some evidence that suggests that family counseling for substance use disorders can be more effective than other forms of treatment with teens. So, specifically, there was this meta analysis that was done that looked at 45 eligible experimental and quasi experimental studies, and they showed that family therapy was found to be more effective when compared to other treatment approaches and indicated bigger improvements. And that was in comparison to things like group therapy or just CBT alone or things like that. And then lastly, family involvement has the potential to decrease risk factors and increase protective factors for teens regarding substance use and regarding recovery. So I want to touch on that for just a moment. So, unfortunately, there's no way to predict who will develop a substance use disorder or not. I wish there was. But we do know that there are certain risk factors that can increase someone's susceptibility to using substances and potentially developing a substance use disorder, while protective factors can kind of mitigate those risks. Oftentimes families, they don't realize how much influence the home or like parental perceptions or behaviors can have. So part of our work is really providing psychoeducation to families on how, even as a proactive measure, they can really make choices to lessen some of these risk factors for teens and to really increase some of these protective factors, because all of those protective factors really help in establishing a secure attachment for the child, which can kind of help to counter and protect adolescents from developing substance use disorders and recovering from them, sort of acting as a bit of a defense. So for all those reasons, I know we went through a bunch, there is a lot of support to including family members. And yet, a piece that I think is sometimes missing when we do start including family is understanding potentially how affected the family members and the concerned significant others have been by substance use. So, as clinicians or individuals who work with people with substance use disorders, we know that the impact of substance use on the family can include any of these. It can include more as well, but these are definitely ones that are very common that we tend to see a lot. And I do think there's a general acknowledgement of this, but at the same time, there can unintentionally be a lack of space, maybe, and patience given to families, because typically the identified patient coming in is going to be the teen, right? That's our focus. That's the person we're working with more directly. But it can actually be really useful to step back and try to understand the family's experience too, because how they are affected contributes to how they respond to their teen and the family system and the patterns that we're kind of seeing playing out when they come into the room.
Yeah, and Lindsay, I just want to say that at the RTC level, at least, it's interesting because we see families coming in and who are very aware of the way that they've been impacted by the substance use and how it's impacted the family dynamic. And other times we definitely see parents and families either coming in like in denial, or they're really just like struggling to acknowledge like the way that they've been impacted because they've been so focused on attempting to keep their child safe and healthy and alive, basically. So we definitely see a lot of different families coming in at different levels of awareness of how they've been impacted in this way.
Yeah, completely. I think that's a great point that, their level of awareness might completely be different based from family to family. And one thing that I actually think, in addition to these impacts that we have here, and actually it's on the next slide, another area that I think family may not always be able to articulate in addition to these are that sometimes a lot of our families are experiencing trauma symptoms as a result of the substance use in the family. So we often recognize this correlation between individuals who use substances and those who are experiencing any kind of trauma symptoms. However, we aren't always, as aware of the connection between these symptoms and those who have a loved one who is addicted to substances. So I actually created this list specifically with families in mind. Family members often endorse a lot of these symptoms. Now, of course, the degree to which they might be experiencing them can, of course, vary based on maybe the level of use that's occurring within the family, or the length of use that's been happening, or the severity. But the reason why I think it's important to name these specific impacts, whether we're talking about these ones here or we're talking about the ones from the other slide, is just because understanding this impact, it can inform how we support the individuals and the families that we work with. These impacts they probably do affect how they're coming into the room, right? And if we're not aware, then we might view certain behaviors from the family as maybe, pushback. Maybe we view it with a little judgment, maybe as willfulness or as coldness or unfairness from the family, right? But oftentimes these impacts are really at the core of what family is experiencing. And us knowing these potential barriers can really help to the families to understand what they're experiencing through, psychoeducation, through us providing validation and supporting them and engaging more effectively. So, I'm going to actually pass it off to Ellen to kind of look at some other ways that understanding these impacts can also help us support our clients and families.
Yeah, so what Lindsay was starting to express here is that it's important for us to know how the family has been impacted because it informs the work that we do with the families. At Evolve, the family work is a key piece of our treatment as clinicians, work independently with parents for parent sessions, and also the client, having the clinician have the client and the parents join for a family session. So it's important for us to know all of this because it helps us develop empathy and understanding for all family members. It definitely impacts our rapport with the family, with the parents, with the client. It helps us gain trust. It affects how we may approach the family in family therapy, really starting with where they are at. And it helps us to know which interventions to use with this family. Um, it's important to remember that this impact that we're talking about, it doesn't happen overnight. And just like the progression into a chaotic use of substances, yeah, it doesn't happen overnight. And like, that's really what we're going to focus on in the next couple of slides is this progression of addiction. So the family and the client are in something called like an integrated experience. It basically means that behavior impacts behavior. And although the family might feel very out of control and are out of control, in a sense, the parents tend to forget or perhaps don't even know that they do have influence and impact over their loved one and their treatment. This is why the family work, again, is like so important because it is influential. I think that's like a really key piece is that I think a lot of parents coming into treatment feel very out of control and don't know how to help their client. But I think this is where we really reframe and like support them with identifying how they can influence their child's behavior in some ways. So we're going to go to the next slide and kind of go into this chart. I'm going to walk us through it a bit. This chart depicts how the identified patient and the family cycle through this the progression of addiction together and how they impact one another and have influence over one another in this integrated experience that I just spoke about. So as the identified patient begins to use more, the progression of addiction can become more risky, which can cause more chaos in the identified patient's life and in the family life. Parents and the family members of the identified patient tend to behave and respond to the identified patient's progression of addiction. And so we kind of have like 4 quadrants here, sort of. We're going to start at the top right section and just identify, that we see the use of the identified patient becoming more risky or more frequent. When this occurs, typically the family members begin to experience feelings of anxiety or fear or disappointment, or they're feeling pre-contemplative. These feelings tend to be at the core of what family members feel when they see their loved one's use increase. And typically they want to interrupt the identified patient's progression of addiction out of love or fear, or again, some anxiety. Looking at that bottom right section, as the identified patient experiences impairments due to their increased use, family members can also experience their own impairments. Some of these impairments for family members can be impairments at work, or being unable to participate in other relationships, impairments in their ability to effectively communicate to the identified patient's use. Communicate with the identified patient. And it can lead, again, back up to those feelings of fear and anxiety at the top right section. So the parents and loved ones, going over to that bottom left section, the parents and loved ones often desperately attempt to reduce or eliminate the natural consequences or the impact of the identified patient's use because they care. An example of what this can look like is the client might get too high, they sleep in the next day, they miss a big test, and then parents are there emailing teachers, making excuses, and attempting to problem solve. Another example of this is the identified patient's use leads to like breaking laws, and they might be on parole, or they might need court mandated drug screens that need to be negative, and parents may lie for the client or enable their use or help them pass the drug screens. the result of the parents acting in this way often cause the parents to feel feelings of resentment or frustration or sadness. And oftentimes parents in these situations feel stuck and they don't want their child to face these like really hard and natural consequences to their actions that could potentially impact, their future, getting kicked out of school, being, in juvie, that sort of thing. And so parents are really like desperately trying to make and like or maintain homeostasis through this process. And it can be very reinforcing and at times enabling. Looking at that top left section there, the family continues to respond to the identified patient's behaviors. And the identified patient then responds to the family environment. And this isn't inherently like bad or good, like both parties have the ability to change the outcome as family members begin to understand their influence in the dynamic. They have the opportunity to disrupt the cycle and take accountability and influence the change needed in the family. And so in the same way that families progress through that cycle of addiction, they also are able to recover through this concept of like the parallel process. So this process of the family members, specifically the parents, acknowledging how their own behavior impacts their teenager through the cycle of addiction is in itself the parallel process. It's a concept that asks parents to reflect on their own patterns and behaviors in response to the identified patient through all stages of treatment. It suggests that treatment and recovery for the identified patient can be influenced, again, that word that we were using before, their behavior influences behavior. And it helps engagement and response from the family to the identified patient. Engaging in the parallel process allows families to break free from the role that they play in their family unit and understand how their role impacts their response to the identified patient and how it can contribute to their overall well-being. And so when looking at recovery through the parallel process, it's helpful to be mindful of potential obstacles that family members might have to work through. In addition, it definitely impacts it impacts the family when they're able to, support client in this way and overcome some of that family homeostasis, which we're going to break down a little bit more in the next slide.
Yeah. So, family homeostasis. So, homeostasis is the desire for the family to keep their family system stable and balanced in the face of extreme stress or dysregulation. So, this is something that we see a lot in families where persistent substance use is present. So, as that disruption, which is the substance use, is happening, the family is trying to maintain normalcy. And I put normalcy in quotations because it's not a general standard of normal that everyone's aware of. It's whatever is normal for that family. So the family does this by adjusting their own behaviors to keep the family functioning. They don't want any more disruptions because they're already having this really big one that they're having to deal with. So the visual that I was always given when I was learning about this was like a baby mobile. Okay. So imagine that there's a baby mobile that has all the pieces dangling off and, like someone grabs one side of it and now all of a sudden the mobile is kind of like bouncing around and moving. So basically, all of the other pieces are bouncing and moving, trying to regain that equilibrium, trying to regain that balance to that balanced state. So that is kind of exactly what's happening when we're looking at homeostasis. Now, this can actually be present in active use and also in recovery. So in active use, this is where we're going to see some of those maybe unhelpful reinforcing behaviors that Ellen was just talking about. Things like, the mom is calling a coach that they can't go because they're sick, but really it's because they're hungover. Maybe it's a younger sibling is covering up for their older sibling, or maybe they're picking up chores You know what I mean? Like the chores of other members of the family, right? This is kind of where we see those family roles develop, those things like the enabler, the hero, the scapegoat. The idea is that all of these family members are taking on these different roles again to try and regain that balance and that functioning, so that there's not additional disruption, because there's already a big disruption that's happening. But the problem with that is that over time, that becomes the adjusted normal. That becomes the new normal, right? Because when you do something enough times, then that becomes the new normal. So now these new roles, that becomes the standard. So what happens is that you can have, let's say we're talking about the teen, because that's who we work with. They go and they receive treatment and they come back to the home. What we might end up seeing is the family kind of fighting against change, or sort of really having a hard time not returning to old behaviors that they were doing during the active use, even though the substance use isn't there anymore, even though that initial disruption isn't happening anymore. So from the outside, that might seem dysfunctional or not helpful. But again, it's really because they're going back to what feels like that normal for them. But that can be a concern, right? Because it works against ultimately the family's desire. And usually that's for their loved one to remain sober and for things to shift in a positive direction. So in recovery, some examples of this might look like, maybe the family not attending family sessions or not following through on treatment agreements. Maybe it's they're not allowing their child to handle things that they actually are capable of handling and are ready to handle. With siblings, I see this a lot of times. Like maybe you had an older sibling that was the one who was using substances, and the younger sibling had to step up a lot, and the older sibling goes to treatment, gets better, comes back home, and now they like want to take their place back as like the older sibling, right? Like I can handle these things again. And you'll actually see maybe the other sibling getting mad or angry at them when they try and take those responsibilities back on, right? So again, the family might struggle to adjust to a healthier new normal and not revert back to those old behaviors when that substance use was active. And, that's a barrier because it keeps the family stuck sometimes. These roles and these behaviors that oftentimes come out of a place for survival can end up really interfering with positive and lasting change. So then, the question is, what can we do? What can we do to help families to heal together and to kind of break through this homeostasis? Because we want to support them in breaking out of patterns that are no longer serving them in helpful ways. So luckily, there are a lot of different interventions and things and therapeutic approaches to disrupt homeostasis. Here we've named just 3 that we're going to be going over today. These are not the only options, but they're the ones we are going to focus on. So first, I just quickly want to go over psychoeducation. So this was the first treatment approach for family members, and it really is important, even though it seems very simple. Like, of course, we always want to provide psychoeducation. I know that, yes. But again, it really is such a foundation, especially when we're working with families where substance use is present. Now, depending on the family or maybe how much therapeutic treatment the family has had before, that might inform what type of psychoeducation is needed. For example, you could have a family where they're like, this is the first time, I didn't even know this was going on, I don't really know what to do. They might need a lot of basic psychoeducation on what, addiction is, what warning signs are, what triggers are. They might not know that, but you might have another family coming in. I know this happens unfortunately a lot. We get a lot of teens coming into our outpatient and they're like, this is my 5th treatment center, right? Or I've been hospitalized 5 times, right? So in those cases, the family members might have a pretty good understanding of some of the general psychoeducation, but maybe they don't have this deeper understanding of homeostasis, right? Or the family roles, or how that's been contributing to the dynamics in the home, or why they're happening. right? So exploring these things can really help the family to break out of these old patterns, and really assisting and empowering them to kind of choose different behaviors moving forward. So then I want us to move down to the second one, which is including family and relapse prevention planning. So there's two ways that we can actually do this, or two ways that we're going to talk about today that you can do that. We're going to go over those in the next couple slides. And then the last one is going to be, so in behavioral family counseling, it's really about focusing on the family unit. So it can include a whole bunch of different interventions like cognitive restructuring, boundary setting, communication. But the one that we're going to be really focusing on today is going to be contingency management. And again, we're going to be going into depth on that. But whichever intervention you use, whether it's one of these or it's another intervention, ultimately, when working with the families, the goal is going to be to disrupt that homeostasis.
Yeah, and so including the family and relapse prevention planning, we're going to get into that right now. So creating a relapse prevention planner, it's something that we typically do with our clients, but we don't always consider the different ways that we can include the family, and how this intervention can be beneficial to not only the client, but like every single individual family member, and help the family system as a whole. So there's a few different ways to include families. First is to include them in your client's relapse prevention plan. And then the other that, like, Lindsay's going to go into both of these in depth, but the other is to support families in creating their own relapse prevention plans, to prevent them from falling back into that homeostasis that we talked about. Both approaches allow the family members to be active participants in the client's care. So Lindsay, you can go ahead and I guess go into the relapse prevention planning with the family support.
Yeah. So, okay, yeah. So let's start here. So as we kind of talked about in the beginning, we know that community and family positively influences treatment and change, right? And actually, there is some research that also shows that when families are, part of relapse prevention planning, they're able to provide support. They're be able to assist with things like, accountability. There actually is lower relapse rates. So we talked in the beginning about how everyone's going to have different levels of family interaction. I would say even if you have limited family involvement, this is a great thing to prioritize, even with those families or even in those situations. So I've kind of broken it down to 7 steps. So the first is that you're going to create a relapse prevention plan with your client. Okay, so that's something you're going to do with them just as you normally would. And then you are going to discuss with the client the benefits of including the family. And this is also a really good time where you can ask them if there's any areas that they're, maybe not comfortable sharing with the family. That might be because, I don't know, maybe their dad is listed as one of their triggers, or there's a certain place listed on there that they aren't comfortable sharing yet, or maybe they've had experienced some kind of trauma and that's on the relapse prevention plan, right? So asking this question ahead of time really allows us to explore the apprehension with them, differentiate between, when it might actually be appropriate to maybe, okay, maybe we don't share that right away. That's okay. Or maybe allows us to sort of check the facts on other things, which might help the client to sort of realize, okay, well, maybe this actually would be good for me to share, even if it feels really hard, right? So it kind of opens the door for that conversation. Because ultimately, again, we want to remember this is the client's relapse prevention plan. We want them to understand that they have a choice and a say in this. And so we want them to feel supported. Now, then number 3, you are going to discuss with the family the purpose of this session, of why you're going to be bringing the family in. You're kind of going to give the family a prep call or sort of orient them to the process. This is also a great time to provide general psychoeducation to the family. Like, hey, some things that might come up is we're going to be talking about triggers. We're going to be talking about warning signs. What is your knowledge of those things? Have you guys heard of that before? Really, helping them to get that basic general psychoeducation before we go into the session. So those are all things you can do with the family ahead of time. And then you're going to schedule a session to bring the family in to review the relapse prevention plan, really understanding that this is going to be the specific focus of the meeting. And it's also a good time to, orient them. This is what it's going to look like. We're going to bring you in. Let's say the client's name is Alex. Alex is going to, walk you through his relapse prevention plan, and you'll have an opportunity to respond. Then we'll work together to kind of problem solve and cope ahead for some potential situations in the future. Okay. And then once the relapse prevention plan is shared, I always suggest leaving space for the family to provide additions based on their observations. So the reason why this can be really helpful is because family members are often really aware, and I'd say even hyper aware of signs that their loved one is either at risk of relapse or has begun to use substance again. So including them can help provide additional insights that maybe the client hadn't even thought of. So if I were going to give you an example, let's say mom's in the room with Alex, who's the client. I might say something like, Mom, after hearing these warning signs, do you have any thoughts? Is there anything else that you tend to see that's not on this list, that are typical signs that you notice before Alex starts using substances? And the mom might say something like, yeah, well, they had isolation on there. I definitely see that. But it starts before they're ever just completely isolating, usually starts with them just not having family dinners with us, right? Or it starts with, I ask them to go do things with me and it's no, or they stop watching movies with us, right? So now they're maybe giving us some more specific information that could be added to the relapse prevention plan, or could be added for us to explore with our client later in session. So I do want to just quickly articulate that when I'm asking for responses or feedback from the family, that this is not a time for parents to critique their child if they feel the plan is good enough, if they think the plan should be better. That is why it's really important, going back to number 3, that I have talked to the family ahead of time and I have explained to them, this is really about us providing support, providing validation. If something comes up throughout the meeting that you want to handle, we can definitely look at that, but I might redirect it in the moment if I feel like we're getting off topic, right? Because we really want this to be a supportive environment. And that's why we orient the parents ahead of time. So again, you might have certain family members where you do have to do that, right? You notice something happening and we kind of redirect it. So the family's kind of already been prepped. So let's move on to number 6, which is identify then steps that family members are willing to take to support their child. So I might say something like, Mom, Alex has you here as a supportive person of their recovery. What kind of actions do you currently take, or do you think you could do to help support him throughout this process? You could ask Alex, is there anything else that would be helpful for you? So some families might easily be able to answer this. Maybe they say something like, yeah, well, they want to go to meetings. Like, I can take them to meetings, or I can make sure they have access to the car, or I can go with them if they're nervous to go, right? But you might have other families that are like, I have no idea. I don't know what I could do. I've never done this before, or we've never been in this situation, so I don't know how I could help, right? So that's also where we're going to be wanting to use MI, solution-focused approaches, to kind of really support the family in problem solving and identifying areas to kind of help them come up with like, what are some, because again, this isn't just about the client. This is now looking at the family of like, what can you do to support this, right, for the best outcomes? And the other kind of thing that I want to mention is that, recovery is about so much more than just abstinence. And I say that to my clients that I work with all the time. It's not just about, am I using the substance? Am I not using the substance? Like, you look at the definition of recovery, and it really is about living, your best, most fulfilled, self-directed life, really building the life that you want. So you can also look at maybe activities that they've mentioned in their relapse prevention plan that they enjoy, or that they like or can do instead of using. I know in my relapse prevention plans, I'll have areas for that where it's like, list 10 activities you can do without using, right? Or 5 new activities you'd be willing to try. So you can actually go to those areas and see if there's anything family can do in those areas. So let's say on their client's relapse prevention plan, they have that they like hiking, or they like watching I don't know, movies, or maybe I had one client who was like, I want to learn how to play pool or something like that, right? So, okay, then maybe mom is able to, in that case, be like, oh, well, like, I'm happy. Well, why don't we do weekend hikes together? Or like, I want to learn how to play pool, or maybe we do a family movie night, right? So those are ways that family members can actually be supportive and help with recovery, right? So again, kind of helping them to understand there's also like broader ways that they can provide this support. And then the last one here is going to be collaborating with the client and the family on how to approach challenging situations, such as things like warning signs and lapses and relapses. So again, in this meeting, I wouldn't necessarily say that this is when you would, again, go into the psychoeducation of it. Hopefully, you've already provided that information to both parties prior to this. This session is really going to be about the action. It's really going to be about the problem solving. So, a big piece, I guess, to put it into action, I would maybe say, like Alex, what if mom starts seeing these warning signs? Is there a way that it would be helpful for her to bring it up to you? And I've had some clients where they're like, well, I just want them to ask me, but I don't want them to make it all awkward and weird and like pressured. And it's like, okay, so what would that look like? And sometimes with families, I come up with an actual script that they both agree to, that it's like, if you're seeing this, parent, you will say this, right? And it's very easy. I've had other people where it's like, I would rather them, I can be with them, but maybe they text it or write me a note, because I get that anxiety in the middle of the conversation or something like that. So again, it's really an opportunity for the client to kind of advocate for themselves on helpful ways to address concerns, to role play and practice these situations. And again, come up with those actual concrete steps that they can do.
Can I say something about that, Lindsay, too?
Yeah.
I think when you say coming up with that script and whatnot, that oftentimes does work. And then also on the flip side of that, really supporting the parents and the client with the skills, like DBT skills, to really approach those situations in the moment. If the client, if a warning sign is the client goes to their room and they sleep for an extra hour or something like that, the client very well may just be tired. And if the parent is like, oh no, that's a warning sign, really teaching the family and the client to keep that line of communication open, because if this is already being reviewed prior to discharge from RTC, for example, and then that warning sign occurs, it could be potentially a little startling for parents to see, I think.
Totally. And actually, when we talk about the parent relapse prevention plan, that's exactly the point, because, how do you always maybe differentiate between, when it's an active warning sign versus oh, I just really don't want to have dinner with the family tonight because I, have homework to do or something like that. Right. But again, what you said about the communication is spot on, which is we want to open the door to that communication and practice being able to bring up these things and it not feel so awkward and it not feel so weird. Right. And sometimes the answer might be like, oh, thanks for, well, okay, kid probably wouldn't say that, but she might be like, no, mom, it's not that, it's just this. But I know it's a warning sign, right? But again, that at least is getting the dialogue going that, okay, I recognize this, you recognize this. And also, again, planning ahead, not just for seeing warning signs, but also lapses and relapses. What is that going to look like if there's, a relapse? Is it, okay, we're starting home drug screens or increasing them? Or let's say you have a teen that does have a sober support, or let's say, a sponsor or something. Okay, the parent might say do I have permission in that case? If you don't want to talk to me about it, can I reach out to them? Or can I reach out to your therapist? Would that be okay? Because the teen might say yes. I don't know if I'd be comfortable talking to you about it, but if you see this warning sign, then you can reach out to my therapist and let them know. Right. So again, that's still an action plan. So basically including the family becomes more of a collaborative experience, and it helps to initiate kind of what Ellen was saying, some of those tough but really important conversations. For the families, it's an opportunity to kind of like validate and support their child, all those things that can help with those protective factors that we talked about in the beginning of the presentation, right? While also recognizing some of the effort, seeing some of the work that their child's putting in, which for a lot of families, parents kind of really want to see that, want to feel like there is movement. And for the client, it really allows them a chance to sort of advocate for themselves, to practice sharing challenging information, but in a supported environment, and to show that they're willing to be vulnerable. And all of this can really help towards, rebuilding some of that trust that most likely has been broken down, and rebuild more healthy communication, and identifying ways they're going to show up for each other. So kind of going to what Ellen had mentioned about, the families, it might be a little triggering for families. We got basically supporting families in creating their own relapse prevention plans. And this is not one that I always see happen as much, but I think it's extremely beneficial. And I know a lot of families who found it really helpful. So we spent a lot of time during this presentation sort of highlighting how, family members go through their own process just as the clients do. So prioritizing families creating their own relapse prevention plans can be helpful because just as the client is at risk for relapse onto substances or whatever their target behavior is, families are also at risk of relapse back to that homeostasis, right? Back to returning to the old behaviors, the old strategies to cope with the stress of living with the substance use or with the addiction. So here are some steps that you're going to take if you were to create a family relapse prevention plan. And spoiler, it's going to look pretty similar to creating a relapse prevention plan with your client. So you're going to assist the family in identifying their own triggers that could put them at risk for engaging in those old and helpful ways. So, going back to our examples before, maybe their child saying no to joining them for dinner, right? Because that was a warning sign. Maybe it's them coming home late. Maybe it's they didn't respond to a text right away when they were out with their friends. Maybe the trigger is actually that there's a lapse, or maybe the trigger is that their child comes to them and tells them that they're experiencing high urges, right? So what are those things that could put the family at risk of being triggered? And then how can we support the family in identifying effective ways to cope when they're triggered? Okay. And this is where teaching skills, just as we would with our clients, is going to be so helpful. So, thinking of those DBT skills, things like tip, grounding skills, healthy boundary setting, communication, all of these things, you guys, how can we teach and support parents to have these? Because if they're unable to regulate themselves or communicate effectively, then it can really affect how they're able to show up in these really stressful moments, which are going to be stressful, right? And so is there ways that we can help them to, again, manage their side so that they don't unintentionally escalate the situation? Whether or not these triggers have real what's the word I'm trying to say? Whether or not the triggers are factual, like something really concerning is happening, or even if it's just that they're feeling triggered and there's not actually recent use that's occurred, right? Either way, we want them to be able to manage that trigger. And then we want them to identify their own thoughts and cognitive distortions that could lead to a return of old behaviors. So, for example, let's say that their child comes to them and they're like, I'm having a lot of urges. I just don't know if this is working. I just really want to use. For a parent or for a family member, that is going to be really, really hard to hear. You know what I mean? Like for most family members, that's going to be really maybe scary. That's going to be maybe really frustrating, concerning. It might bring up a lot of different emotions, right? So oftentimes family members might start having their own thoughts or cognitive distortions that don't necessarily help the situation. They might start thinking things like, oh my gosh, they're going to use, or this treatment isn't working. I need to find them another program. We need to switch therapists. Like they can start having all these thoughts that just start kind of like spiraling, and then could end up really, cognitive behavioral triangle, right? It can really affect, how they feel and how they're going to act and how they're going to behave. So, how can we support family members in identifying what those thoughts are that can kind of lead them to those old behaviors? And then we want to support families in identifying what did their community supports look like. We talk so much about how community is so important for the individual that's using substances, but it's just as important for the family members. Again, going back to those impacts of substance use from the very beginning of this presentation, you know, a lot of family members might be feeling isolated, alone, frustrated, had these breakdowns in relationships. But even if they haven't, it's great to be able to ask them, what does your support look like? And they can be like, I have a really strong support. I have this person that I can call, this person. Great, right? Just like we would with our clients. And if there are any areas where maybe they're like, what, I really don't feel like I have anyone to talk to about this, then okay, how can we support them in identifying some places that they can get that? And going along with that, same thing when it comes to the self-care, parent, what are you doing to, decompress, fill up your cup because you're going through a lot, right? This is a really hard situation. It'd be a really challenging situation for anybody. Like, what are you doing for yourself? Because if you're feeling depleted, the chances that we're going to be able to effectively show up for other people around us and not get irritated or agitated or, more emotionally triggered, that's going to go down, right? So what does that look like for them? And then the last thing is going to be helping the family to cope ahead for triggering situations. So this is really important. And I want to give an example. Like, one thing that we see in outpatient here at Evolve a lot is teens who are going back to school, right? So if a teen was going back to school, we spend a lot of time coping ahead with the teen on going back to school, right? Like, how can we make sure, they have their plan, they have their actions, they have their supports? What does that look like? But I can tell you right now, a teen going back to school is probably going to maybe be really triggering for the parents too, because the parents going to say, that's where they used to use. They've gone suspended from school. I know people are using in the bathroom. They might have all these things that are fears. So again, what can we do with the family to help them cope ahead for the situation as well, to, and part of that coping ahead and also being like, how can we support the teen? Okay. So depending on your level of family participation, this relapse prevention plan might be something that's really brief, where you're just bringing up these questions and maybe helping them identify one or two things. If you're not in a situation where you're meeting with family regularly, or you might have a family where you can do this a little bit more in depth over, a session or two. It might vary, right? Depending, but that's okay. And as an added bonus, sometimes when we do this, it can also help with the teen feeling like, parents are putting in, a little bit of work, a little bit of effort as well. But really, this is for the parents. This is really for themselves and for the parents to get the support themselves.
Yeah, I agree with that. I think like when parents put in this sort of effort, like you're saying, Lindsay, where it's on paper, clients do have a sense of like, okay, I'm not doing this. It's not all on me. I'm not doing this all alone. And so I really like the idea of having like a family relapse prevention plan, so that like you've been saying, like this prepares families, prepares parents, for thinking about how they can support and like influence, as the client returns home or is home. And so I have a question for you. I was hearing all of that and I'm wondering, and you kind of like maybe touched on this a little already, Lindsay, but would you recommend this to all families, basically?
Like
Like for
doing a family relapse prevention
Yes.
plan?
Mhm.
Yes. So, okay. So, yes, so I
Okay.
actually do think that this can be useful for all families. I really do. However, I also understand that there are going to be barriers that to consider, right? That might make this challenging to do. So, I mean, I mean, really, a big one that comes to mind is, where the family is themselves in their own stage of change. Like what the family's willingness is to explore and engage in the process. I know I've had, and I'm sure a lot of you guys here have had those families where it's like, well, why do I have to change? Why do I have to do anything? My teen's the one who's using the substances. They just have to change, right? So again, is the family in that pre-contemplative state, or where are they? And also just what is their level of insight and skill knowledge? So there's definitely some barriers to doing this, but I also feel like that's kind of where we come in, like that's where we come in with the psychoeducation, and that's where we come in about the supporting and the teaching skills and understand. And I guess I would say it this way, that yes, I think that it can be useful for everyone. But knowing that there might be some barriers, how we approach this might be different for each family. So you might have to do this instead of being like, we're going to do a family relapse prevention plan and going through these. You might have to do one at a time or over a long period of time. You may need to just to not overwhelm them, or maybe you start in one area that you think the family might be more receptive to, lean into those MI techniques, right? And then once they've noticed that's been helpful, okay, maybe we try this other thing. So for example, if I had a family that was really resistant, I might just really try and validate their experience, and maybe instead I would just be maybe I want to just focus on their community supports first. Maybe I just be like, yeah, like I said before, oh, this must be really hard for you and challenging. What about you? We keep talking about support for them. What does your support look like? Do you feel like you have people in your corner? Do you feel like you're getting, what you need? And if not, how could we strengthen that? So again, that's a roundabout way of getting the information, but maybe not in a way that seems so formal if you have a family that's a little bit more resistant. So we might have to be a little flexible with how we create it.
Yeah,
So.
that's really helpful. I think I think for sure this is going to look different for every family. And so as clinicians, just keeping that in mind and remembering to, again, meet the family where they're at, and also assess for their needs, and listen to their family goals and whatnot. And I think this is a great way, just in general, like I said, to incorporate families into the work that we do with clients. I know another intervention that we previously talked about earlier in this presentation is contingency management, which we'll get into, which, further supports families with implementing in the home environment.
Yeah. So, okay, contingency management. So another intervention that's really useful with this population, with individuals who have substance use disorders, is going to be contingency management. So contingency management, is a evidence-based behavioral intervention. It provides motivational incentives to influence behavioral changes. So this is something that can be used as a treatment approach. There's actually even some programs that are contingency management programs. I think here in California, actually, we have some approved for maybe Medicare, I think maybe, but anyway, side point. Or it can be sort of adjusted to work in the home. Now, contingency management is one of the main recommended treatments for substance use disorders. It has over 3 decades of research. It initially started as a treatment for stimulant use disorder, but research has shown its effectiveness with other substance use or other substances, and even some efficacy with co-occurring disorders. And one of the benefits of CM is also that the research shows that it's really effective in a really wide range of diverse populations. So the goal is going to really be to reinforce abstinence and to increase other recovery-related behaviors. So it's been shown, in addition to decreasing substance use, it's also been effective in increasing treatment attendance and things or treatment retention, medication compliance, completion of therapeutic activities. So that's kind of what we're talking about when we're talking about recovery-related behaviors. And then when we talk with families about implementing contingency management, I do think that it's really important that we let them know that it really is recommended to be done with support of other therapeutic approaches as well to strengthen its efficacy. But when we're using this in a family therapy setting, it can be really great when we look at, be essentially a vehicle for problem solving in a structured and an agreed upon format. So we're going to kind of go over it a little bit more with some examples, but CM has its roots in operant conditioning. So it provides, mainly uses positive reinforcement, but it also can use negative reinforcement as well as positive and negative punishment. So I wanted to give a little bit of a review of each of those and some examples, because I know for a lot of us, maybe this is something we went over in school, but it's been a little bit of time. So let's start with positive reinforcement. Because again, this is going to really be at the core of a lot of CM, because research shows that it is most effective when engaging clients with substance use disorders. So positive reinforcement is all about adding something that's desired, incentives, to increase the likelihood of an identified behavior happening again. So maybe you guys identify that the behavior you want to increase or change is going to be abstinence, or attending weekly therapy sessions, or maybe them attending a full week of treatment without any absences. Okay. So, and then how can we use incentives to increase that behavior? And I know that I mentioned that CM is really effective for people who have substance use disorders, and there's actually some research as to why this might be. So I'm going to kind of like try and summarize it. Basically, substance use disorders really mess with the brain, a lot of areas of the brain and the body, but it really kind of hijacks the brain's reward system and how we learn, how we make decisions. And when someone uses substances, the effect, the desired effect that they get from the substance reinforces them to continue to do that behavior, right? Like I feel good. My brain tells me that I repeat this action. And so over time, they become really used to that instant gratification or that instant relief that they get from the use. And that's kind of where contingency management comes in, right? Because by providing that immediate reward, CM is kind of utilizing the same concept. It's acting on areas of the brain that actually might be more sensitive due to the substance use that's been happening, to that like immediate gratification drive that they have. So it's kind of just a side thing I want to mention. So it kind of does that in addition to also helping them with, making decisions and processing things that may have in ways that are healthy for them, right? Helping to kind of rewire some of these different areas of the brain that have been affected. So let me give an example of how we do this at Evolve. So at Evolve, at least in our outpatient, we have a point system. So every time a teen attends a full treatment week, we will give them, let's say, 5 points for attendance. Okay. And those points get added up. And every week they have the opportunity to, okay, I want to keep saving my points, or to cash in their points for a list of pre-approved rewards. So it might be things like a fidget toy, right? Or kinetic sand or art supplies or things like that, right? So again, the behavior we want to change is them attending the full, or we want to increase is them attending the full treatment week. So the incentive is the points, right? And then they get the points hopefully to increase the attendance, right? And I think it might be different in RTC, but the rewards you got might be more phone time, or more, other things that they might get in addition. It doesn't always have to be a physical thing. So then we have negative reinforcement. So negative reinforcement, on the other hand, is about removing something undesired to increase the likelihood of something that is desired. So what does that look like? Let's say, again, we're going to stick with the same thing. Let's say we're trying to increase them doing that full treatment week, attending the full treatment week. That's the behavior. That's the identified behavior. Okay. And let's say we know that teen hates doing weekend chores. They're always like, I do school all week, and then I have to do a program, and then the weekend's my only time I get, and then I have to do a bunch of these chores. right? So we might then say, okay, if you can attend the full treatment week, then we will remove you having to do like one of your weekend chores, right? So we're removing something that they don't want in order to increase, them hopefully attending the full treatment weeks. So that's kind of an example of that. And then we go down to positive punishment. So positive punishment is about, in comparison, adding something that is unwanted. So this could be like adding in additional homework time, additional supervision, or adding in drug testing, right? So adding something in that is not wanted to increase or decrease the likelihood of an identified behavior.
Yeah,
Um,
and I can give an example of that, what that looks like in residential
oh yeah,
treatment. So when a client engages in an unsafe behavior or an aggressive behavior, we have a whole process and protocol of how we support the client through that. And, after making sure the client is safe and removed from the milieu and using skills and a little more regulated, we oftentimes have the counselors or therapists support the client with completing something called a behavior chain analysis, which is a very specific DBT tool to help clients reflect on the chain of events that led to the unsafe or aggressive behavior. And doing a behavior chain in itself is not intended to be like a punishment or intended to guilt anyone, but oftentimes a lot of our clients find this process to be very aversive because it does inherently bring up those feelings of shame and guilt, and they're having to reflect on why they self-harmed and what were the thoughts and feelings and behaviors that led to the self-harm incident or other unsafe or aggressive behavior. And so that's an example of adding something unwanted if the client finds doing a behavior chain and this whole process of, that we go through, if they find that process aversive. And so it really requires us to know what our clients, whether it's an outpatient or IOP, PHP, RTC, what they find motivating and what they find aversive. I don't know any client that like sat through that process and loved doing a behavior chain. I will say again, like it's aversive because of the like hard feelings it does bring up for a lot of clients. So I just wanted to say that I think like adding something for all of these, it's going to look different at each level of care. And it's going to really require us as clinicians to work with the family to understand like what the client finds motivating and what they find unpleasant, aversive. So I think it's just going to take a lot of collaboration with the parents.
totally. And also kind of going along, you just made me think of something, Ellen, when you're talking
Mhm.
about the guilt and the shame, which is also like supporting families in communicating and the way to most effectively communicate if they are implementing, let's say, for example, since we're on a punishment, that,
Yeah.
right? It's going to be a lot different if a teen uses and then it's like, you used, how could you do that? Like, you're going to drug test, like, you need to do a bunch of drug tests or something like
Mhm.
that. Like, I can't believe you did that might come across a lot different than, you know, um, hey, I know you had a relapse. This is what we're going to have to do. And I'm doing this because I care about you and I love you and I want to help you, keep yourself accountable.
Yeah.
Right. There's like the way in which we communicate these things also
Mhm.
can make a difference. Right.
Yeah, it goes to back to that like integrated experience for sure. Like
100%.
our behavior, our approach as like parents or clinicians or whoever approaching the client in these moments will influence the way that they respond.
Respond.
Yeah.
Totally. Okay. And then that brings us here to the negative punishment. So negative punishment is it's gonna be about removing something that is wanted or that is pleasant for the child. So I'd say this is the one parents typically know pretty well. This is the one that parents, I say, kind of gravitate towards. This would be they did something like they snuck out or they used and okay, I am removing your electronics. You do not have access to your phone or you do not have time with your friends, right? So that's all about the removing something that is wanted, something that they do want. um yeah, and you can also brainstorm with parents if there's ways to get creative on this, like maybe you're removing their iPhone maybe they don't get access to it and they only now get a very basic flip phone or something like that, right? So anyway, that's kind of the four here. So I'm going to pass it to Ellen to kind of go over a few things to keep in mind with when implementing this, though.
Yeah, so a few things to keep in mind is when we're identifying the behavior that we want to see increase or decrease, we should be very specific to what that behavior is. It should be measurable. Like we want to make sure client goes to DBT group 1 time a week, or attends family individual sessions 2 times a week. So we definitely want to make sure that the behavior desired to increase or decrease is specific and measurable. And this third point, timing matters. Like, this is a huge piece. So when we talk about timing, we want to consider, implementing the reinforcer or the punisher as close as possible in time to when the behavior actually occurred. So it would not actually be as effective to implement the positive punishment several hours or days later, because then the client will not be able to associate that punishment with the ineffective behavior. And same goes for the reinforcers. So some clients need more immediate rewards, and we want to create that association that when they have a desired behavior, an effective behavior, they get rewarded to some capacity. And so we want to support parents, in the home environment with identifying the reinforcers and the punishers. And again, it just goes back to that collaboration and really working with parents to identify those. This next point is to increase incentive over time to maintain engagement. I know at our Evolve Outpatient, this is something that I think we do really well. So Lindsay, can you kind of like walk us through that a bit?
Yeah. So I'm going to stick with our example of the point system that we have. So for example, like with CM, the incentive should increase over time to continue engagement and to keep the incentive appealing, right? And especially for going back to why this works so well with individuals with substance use disorders, right? We need to keep, how do we really continue to activate those areas of the brain, right, that want that immediate gratification? We got to keep it motivating for them. So in outpatient, let's say we also have a level system. So typically level 1, you get 5 points for that full attendance week. But once you're level 2, now you get 10 points for a full attendance week. Maybe when you're level 3, you get 15 points, right? So the idea is they're getting more points. That's the increased incentive. And the benefit of that is that means their points add up more quickly. They have an opportunity to, cash in, I put them in quotations because we're not giving them cash, but cash in those incentives, right? More quickly, or for more things that they want, right? So again, it's that increase. Oh, and also I'll say, like, let's say we were going to use this in the home. Let's do an example that's not actually for treatment. This might be something having to do with friends or something, right? Like, let's say, okay, if you attend the full treatment week, then you get to see your friend on Friday after treatment. Okay, well then maybe after a little bit of time, then they get to have that friend spend the night. Okay, and then maybe the increase is that you get to go with your friend outside of the house, right? So again, those can be steps of increasing a behavior that don't have to do with something like tangible. And something though that we should, when we're discussing this with parents, is that if they are considering increasing an incentive, that we really recommend that they speak to you guys, to the treatment first before doing that, because we often can see with families either them increasing incentives too quickly, which can be really risky, right? And or parents on the flip side not increasing quickly enough, which can result again in that decreased motivation for their child. So exactly, that's kind of
those are definitely like factors to consider there. And I think the last point here is identifying proportionate reinforcers and punishments, like exactly what you're saying. Make sure that it is proportionate to what they're doing. So if the client like just does one chore and takes out the trash, like we shouldn't be like giving them the keys to the car sort of thing, right? So making sure that it's proportionate. And then Lindsay just said this, but we're not like there's no monetary value. You can like advise parents to do a point system of sorts, you know, in the home environment and see what's going to work. I think
Yeah, and I
that
see
figuring
someone
out.
here that says redeem. That is what we call it. We call it redeeming your points.
um,
So it's the very similar thing like Ellen was talking about. Like we would, and we want to be really clear with parents, like do not give money to your teen. Do not give gift cards to your teen, right? So again, yeah, we can do a similar system where maybe they're putting something aside for a reward that they agree upon, right? But
Mhm.
steer clear of that.
Yeah. Yeah, we can go to the next slide to talk about the specific steps to implementing contingency management at home. So you can see that there's 4 steps here, but to summarize, like we want to help the family identify goals of the desired behavior that they want to increase or decrease, identify the tasks that individuals can and already do perform. So what are they already doing that we can acknowledge and praise and support them with identifying that it's effective. Identify potential rewards or consequences. And then lastly, write a contingency contract or home contract to support, you know, the families agreeing on all of these terms.
Ellen, just quickly, because I wonder if some people are, I don't know if people are wondering this, but
Mhm.
do you feel like, is this something, the actual coming up with the plan, is this something you do with the parents and the client together? Or is this something you typically do, with either just the client or just the parent?
Yeah, that's a good question. I think, you know, because I work at the residential level of care and I have like a parent call with parents and then a family session. I definitely use some of that parent call time to support first parents with identifying their like what they're able and willing to do in terms of like implementing some like contingency management strategies in the home environment, like what do they identify as the motivators for client and what do they identify for the client to be aversive. And so I'm really first actually speaking with parents to get them thinking about these sort of things. And then in my individual sessions with clients at the same time, like I'm just helping them on or I'm asking them a lot of questions surrounding what home is going to be like or their understanding of what home is going to be like when they return. And I think we do a lot of role play and I like to do a lot of like worst case scenario, what's home going to look like? And they're like, I won't have my phone. I can't see my friends. I'll only have to go to treatment. And so we kind of like walk through that. And so parents, I'm doing that individual sessions, I'm supporting in that way. And then finally we cope ahead to have an actual family session at some point that where parents will be the ones to deliver this information of like, here's some of the rules that are, you know, going to be in place once you're home and you'll have the opportunity to like earn or, you know, redeem your points with in this way. And like, here are the logistics of that. And then we'll look at a document. And a lot of the times, like the amount of like prep work that I do with clients in individual sessions, like I would say for the most part, the family sessions do end up going relatively okay. And then of course there are those family sessions where the client is like becomes really dysregulated after hearing like some of the plan for when they return home. So definitely all of that takes place over the course of like a couple of weeks prior to discharge.
Nice. Okay. I know we're running close on time, so I'm gonna kind of
Yeah.
skip this, I think, just sort of I think you guys will have access to the slides after, but this is just, this is a key part of substance use disorder treatment. Prioritizing family involvement can influence change, disrupt treatment, homeostasis in treatment for substance use disorders, and including the family in relapse prevention planning and contingency management has the potential to alter the home environment, resulting in healthier family patterns and greater potential for lasting change. Okay.
Okay, I know this can look like a huge case example, but I want to just preface by saying that I'm going to read through it. And the point here is for you all to identify those questions that we're going to ask at the bottom. For now, I would say just write down the responses to those 2 prompts, like on a paper near you. And then we're going to go through and I'll ask you to respond in the chat. So case example, a family is seeking outpatient therapy due to their teenager's use of marijuana. Parents report that identified patient has come home from school and soccer practice high on marijuana at least 3 times a week for the past 2 months, whereas prior to this, they noticed occasional experimentation. Parents report that identified patient's use has become more frequent and that her grades are beginning to drop in all classes. Parents also report that her soccer coach reports that she misses practice regularly, leaving him no choice but to suspend her from the team. Parents report that they have been attempting to decrease the intensity of the impairments caused by marijuana use by emailing her teachers to ask about makeup, schoolwork, and tests. Parents have also reached out to her soccer coach and falsely informed him that the client has been missing practice due to medical reasons. Parents report, "We know how important soccer is to her and don't want her to jeopardize her future." Her parents report that she only cares about being on her phone and hanging out with her friends, so they've limited access to these privileges, although admit that they have been inconsistent with this. They report they've also added extra chores and now drop her off and pick her up from soccer practice, which the identified patient finds annoying. Parents report that despite these consequences, she still comes home from school high and just doesn't care about the rules. Parents are seeking support with finding new ways to manage clients' substance use. So again, I just want you to jot down these 2 points here. I want you to identify at least one way parents are maintaining homeostasis. And then the second point, examples of what the identified patient finds motivating and aversive. We'll give you like a second to do that. And then I think we can go on to the first question, Lindsay.
Yeah.
So in the chat that we have here, if you could please identify one way that parents are engaging in homeostasis. Yeah, enabling, lying for their child, talking about, makeup, we're teachers, telling the coach, because they're sick.
Totally.
Amazing. Making excuses. Yep, exactly.
Yeah, also maybe like inconsistencies with the like phone, things like that. So all of those, yeah.
Yeah.
Okay, great. So let's
go to question 2. So in the chat, if you can just identify one example from any of the approaches in contingency management that parents in the case example implement. So there were a couple of different ones. Lindsay, can you like verbally just like give an example of what this looks like?
Like what it would look like. Like maybe I would say like I'll do maybe a more obvious, maybe I'll say like negative punishment would be taking away the phone. Okay?
Right.
So you would say that. You would say like negative punishment, enter.
Yeah. And then
taking away the phone.
Go ahead and put that in the chat.
And again, remember that positive reinforcement is going to be a way that they could, and this is also, these are things they could do, right? So what is a way they could use positive reinforcement? What is a way that they could use an incentive to increase a behavior? Or how could they take away something that she does not want, using positive punishment? I'm sorry, no, positive reinforcement. I'm just noticing a typo.
Positive punishment, like dropping her off at practice. She does not like that.
Yes, that's a great one. Extra chores from positive punishment, because we know she does not like that.
I will say this concept, it like use the terms can be a little confusing, because I know for me it felt like misleading at times. I was like, what is a negative reinforcement? It just takes a minute to like really understand them. So I hope that when you all come back to this, you'll be able to apply it to your work. But negative punishment, time with friends,
taking video games away.
Yeah, this all looks great.
Yeah, so I love this. And also like part of knowing this with families again is that like sometimes I think parents will get really stuck on maybe one form of this. So for example, like that negative punishment, that removing something that's wanted. Like parents are like, we've done this, we've done this, we've done this. It's like, okay, well then maybe we got to try something else, right?
Yeah.
Like, and again, going back to that positive reinforcement, really working with this population of people. So I'm not saying we could do multiple, right? It doesn't have to just be one, but I mean, like if they're always resorting to that, taking something away and it's not being effective, okay, well then, yeah, is there other ways? Can we be using positive punishment? Can we be using negative reinforcement? Or again, how can we really utilize that positive reinforcement, because that tends to have the best outcomes?
Mm-hmm.
So great. Okay.
Thank you all for participating in that. We have some resources for you all that once you receive the slides, you can review, and then we're just going to go into any questions that we might have.
Yeah. You guys see here just, you know, like Ellen said, these book options and then mutual family support. I just want to just quickly mention because, you know, a lot of times, again, we talk about that support for the individual, but making sure our family is set up with support can actually really help everyone in that environment. So I know a lot of people have heard of probably maybe Al-Anon or Families Anonymous, but Smart Recovery has actually a friends and family program that that I think is great and a great resource. So I wanted to make sure to put that there as well. Okay, so yeah, we can go to questions if there's any.
Yeah, let's go to questions. Okay, so I'm gonna read a question here in order. So how do we incorporate intergenerational impact on the well-being of the person struggling with substance abuse? For example, a grandparent might have a greater influence in the teen than the parent, which could inform the teen's behavior. So how do we incorporate into intergenerational impact on the well-being of the person struggling with
I think it's just saying, like, if someone else in the family that maybe isn't a parent has a really big influence on the team, like how could we utilize that? I think there's I guess first and foremost, I want to say that's kind of why in the beginning when we said that we were talking about family, that we're not just talking about parents. Like all of these things that we're talking about can be, I mean, you know, yeah, you 100% might have a grandparent. Maybe the relationship with parents is really strained. Maybe you have a teen we've had a lot of teens where it's actually because of that, they're staying with a grandparent, right? So I guess that does depend on if the grandparent is involved in treatment, but I guess that would be my suggestion. If there's someone in the family that does have a really strong influence, like a positive influence, that maybe we could utilize that to get some additional support, would be like, can we loop them in to the support system?
Yeah. Okay, thank you. I'm monitoring the Q&A chat. So if you have any questions, please put them in there. There is another one here that I guess we already answered.
Oh, and Ellen, I do just want to say quickly, because yes, I know we're at time. You guys, once you make it to 2, that is, you've done the whole presentation. You guys are welcome to hop off if you need to. You will get credit for being here. But we'll stay on for maybe 5 minutes just to do that.
Yes, thank you. Can Al-Anon help with family relapse? I don't know if this is in regards to the family relapse prevention plan, maybe.
Sorry, I didn't see that. What was the question?
Can Al-Anon help with family relapse? But I think it's, yeah, like the family relapse prevention plan.
Oh, okay. Can Al-Anon help with family? So I would say yes and no. I mean, Al-Anon can help in the sense of family members looking at maybe some of like their self-care, looking at you know, improving like maybe not engaging in ineffective ways that maybe have been potentially reinforcing unhelpful things. But the problem, not the problem with Al-Anon, but it's really more, I would recommend actually more Smart Recovery, because Smart Recovery, if you're actually looking at something that's more with like relapse prevention plans, actual tools and things like that, that's what Smart Recovery is going to be about. Smart Recovery really is an evidence-based program that's based in things like CBT, motivational interviewing. So it provides family with very specific tools that they can use to do things like improve communication skills, right? Positive reinforcement, setting boundaries. So you actually during the meetings get that kind of more specific approach. With Al-Anon, I think it can be more helpful when it comes to creating a community, right? So like identifying, having a community of people for support, and also with like trying to focus a little less on what's going on with the individual and a little bit more on self.
Yeah. Thank you, Lindsay. This next question is, what do you do when family refuses to do this, or if there is parental substance use or ongoing trauma? I will say, kind of referencing something we talked about, is like we have to obviously meet the family where they're at. And unfortunately, I have worked with a lot of parents or families who are either unable or unwilling to make changes within themselves or in their home environment. And all we can do really is provide as much like psychoeducation as to how making these changes and implementing some of what we talked about in this training could benefit the client and support them in their treatment to, have the best outcome for the client with overcoming some of the, or, supporting them through like the mental health or substance use struggles that they experience. And so if there is like ongoing trauma or substance use from a parent, again, we do that. And at the same time, support the family or the parents with hopefully identifying their own supports, therapeutic supports, to get them the support that they need. Do you have anything to add with that, Lindsay?
No, I think the only thing is going back to what I said before about like sometimes families are really resistant. So we have to look for those openings or look for the areas where they might be receptive. And then also in addition to that, would be that is when making suggestions maybe to outside community support or mutual support could be beneficial for family, because sometimes people can be more receptive to things when they're hearing it from people who've maybe been there where they are at, you know what I mean? It can relate directly to the experience, or maybe they are just listening and hear someone be like, this is how I used to deal with it, and now I'm thinking of this, and then it gets them thinking, right? It's not going to be, if you have someone that's really resistant, maybe because they are struggling with substances or because they're just really in that pre-contemplation themselves, then of course it's not something that's going to happen. It's going to be a process, but those are some things to consider.
Yeah. Okay. Lindsay, this is a good question for you. How would you suggest approaching family work with with family or parents who are set on relapse prevention, but your client is only open to harm reduction?
Yes. This happens quite a bit with the teen population, especially, yeah, this is a tough one when you have parents who really want their loved one to stop using, right? And the teen is only open to harm reduction. I guess the way that I approach it with family work is, first validating the family's experience that, this is, for a lot of parents, like they want abstinence because they're like, this is hurting them, right? Like it's hurting them, it's dangerous, or it's hurting their school, it's hurting their future, right? All these things. So really validating that of course, like those are very real concerns, and also providing a lot of psychoeducation. I think parents and people in general, but especially parents, I think, have this sort of idea of harm reduction that seems really scary, of like harm reduction is the, just safe needle exchanges, or it's just this, or it's just, and they don't actually completely understand what harm reduction is. And so I think a good starting place is providing that information of really the wide range of what harm reduction can look like, because abstinence is also included in harm reduction. It's a really big spectrum. And the other way I look at it is like, listen, if you are a parent and you keep trying to and this is even us as treatment providers, right? Like, let's say your child is stuck in this room, and you're trying to get in, and you're trying to get in, and we're trying to get in through the front door. We're trying to break it down. We're trying to hit it with things. We're trying to pull it out. We're trying to do all this stuff. It's just not working. We can continue to exhaust ourselves, to hurt ourselves, trying to get just them to listen, to try and get into that room. But if we see a side door on the side that's kind of small, maybe it's going to be uncomfortable to get into, but like maybe that will allow us to get into the room. And I think sometimes with harm reduction, that's how I have to see it. I have to see it's about limiting risk, and it's about safety first. And if this is potentially the only thing that the teen is open to, then it might not be ideal. Of course, harm reduction, like less risk does not mean no risk. 100%. But I think sort of explaining to parents, really what it actually is, that it is this spectrum. It doesn't mean we can't get there, but we need to get in the room with them, right? We need to be able to even start that conversation. And sometimes moderation or a harm reduction approach can get us started, can get us some movement, and we can always adjust and we can always reevaluate.
Yeah.
But definitely work with a professional. I'll also add that, right? We want to make sure that this isn't something that we're just recommending family doing on their own. That's why it's important for there to be a professional supporting, especially if that approach is going to be happening.
Yeah. Well, that's all the time we have. I want to thank you all for joining us today. Evolve Adolescent Behavioral Health, again, is hosting this, and we just want to thank you because Lindsay is an outpatient, I'm in residential, and we
Bringing us together.
Yeah, we're in this together. So we appreciate all of you attending today.
Great. Have a good day, guys.